welcome back to my channel. Today we're discussing Lichen Planus, a chronic inflammatory condition that affects the skin, mucous membranes, nails, and even hair in some cases. It is an autoimmune related disorder, meaning the body's immune system mistakenly attacks its own tissues, leading to inflammation. While it is not contagious, it can cause significant discomfort and affect quality of life. Understanding its symptoms, diagnosis, and treatment options is essential for managing this condition effectively. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Lichen planus can affect people of any age, although most commonly seen in middle-aged adults. The exact cause is unknown, but it is believed to be related to an overactive immune response. Some cases have been linked to certain medications, hepatitis C infection, or allergens, but for many individuals, no specific trigger is found. Lichen planus presents differently depending on which part of the body it affects. On the skin, it typically appears as small, itchy, flat-top bumps that are purplish or reddish in color. These lesions may have fine white lines on their surface known as Wickham striae. The most common areas affected include the wrists, forearms, lower back, and ankles, but the condition can appear anywhere on the body. The itching can range from mild to severe, and in some cases, scratching may cause further irritation and inflammation. When lichen planus affects the mouth, it is referred to as oral lichen planus. This can cause white, lace-like patches inside the cheeks, on the tongue, or on the gums. Some people experience painful sores, burning sensations, or sensitivity to spicy or acidic foods. Oral lichen planus can make eating and drinking uncomfortable and, in severe cases, can lead to difficulty maintaining oral hygiene due to pain. In some individuals, lichen planus affects the scalp, leading to a condition known as lichen planopilaris. This can cause redness, irritation, and hair loss, sometimes resulting in permanent scarring. It may start with a burning or painful sensation on the scalp before hair loss becomes noticeable. Lichen planus can also involve the nails, leading to ridging, splitting, or even nail loss in severe cases. The condition may affect a few nails or all of them, and in some instances it can result in permanent nail damage. For those with genital lichen planus, the condition can cause discomfort, pain, and irritation in sensitive areas. In women, it may affect the vulva and vagina, leading to painful intercourse and scarring. In men, it can cause red, shiny patches on the penis, which may be accompanied by discomfort. Diagnosing lichen planus begins with a thorough medical history and physical examination. Your doctor will assess the appearance of the skin, nails, mouth, or scalp to determine if the characteristic lesions are present. In cases where the diagnosis is uncertain, a skin biopsy may be performed. This involves taking a small sample of affected skin and examining it under a microscope to confirm the presence of inflammatory cells typical of lichen planus. A biopsy is particularly useful when the condition affects mucous membranes or when it resembles other skin disorders, such as psoriasis or eczema. If oral or genital lichen planus is suspected, a healthcare provider may refer the patient to a specialist, such as dermatologist or oral medicine specialist, for further evaluation. In cases where hepatitis C is a concern, blood tests may be recommended to check for infection, as there is a known association between lichen planus and hepatitis C. For individuals experiencing nail or scalp involvement, your doctor may perform additional tests to rule out fungal infections or other causes of hair loss and nail abnormalities. There is no cure for lichen planus, but various treatments can help control symptoms and reduce discomfort. In many cases, mild skin lichen planus may resolve on its own within a few months to a couple of years, while oral and genital forms tend to be more persistent. For skin lichen planus, topical corticosteroids are the first line of treatment. These creams or ointments help to reduce inflammation and itching. In more severe cases, stronger corticosteroids may be prescribed in the form of injections or oral medications. Patients using long-term steroid treatments should be monitored for potential side effects, including skin thinning and increased risk of infections. Antihistamines can be helpful in controlling itching, particularly when the condition affects large areas of the skin. These medications work by blocking histamine, a chemical in the body that contributes to inflammation and itching. For individuals with oral lichen planus, treatment focuses on reducing pain and inflammation. Corticosteroid mouth rinses or gels may be prescribed to alleviate discomfort. In some cases, topical immunosuppressants such as tacrolimus or pimecrolimus are used to control symptoms. Maintaining good oral hygiene is essential, and avoiding spicy or acidic foods can help prevent irritation. If oral lichen planus is persistent or severe, a dentist or oral specialist may need to provide additional treatments. When lichen planus affects the scalp, early intervention is crucial to prevent permanent hair loss. Topical or injected corticosteroids are commonly used to reduce inflammation in the hair follicles. In some cases, oral medications that suppress the immune response, such as hydroxychloroquine or methotrexate, may be considered for more aggressive forms of the disease. For those with nail involvement, treatment can be challenging, as nail lichen planus can cause irreversible damage. Corticosteroid injections around the nail bed may help slow progression, but results vary. Nail involvement often requires long-term monitoring, and some patients may experience chronic changes to their nails despite treatment. In severe or widespread cases of lichen planus, systemic treatments may be necessary. Immunosuppressive medications such as cyclosporin or mycophenolate may be prescribed for individuals who do not respond to topical treatments. These medications work by dampening the overactive immune response responsible for the inflammation. However, they come with potential side effects, including an increased risk of infections, and should be used under the supervision of a healthcare provider. Phototherapy, or light therapy, is another option for individuals with widespread lichen planus. This involves exposing the skin to controlled doses of ultraviolet light to help reduce inflammation. Phototherapy can be effective for skin lesions but is not typically used for oral or genital forms of the condition. For patients with severe pain or scarring from genital or oral lichen planus, additional interventions may be necessary. In some cases, surgical procedures may be needed to remove scar tissue that is causing discomfort or difficulty with function. Ongoing follow-up with a healthcare provider is important to monitor symptoms and adjust treatment as needed. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, since lichen planus is associated with immune system dysfunction, some patients explore lifestyle modifications and alternative treatments to help manage their symptoms. A balanced diet rich in anti-inflammatory foods such as fruits, vegetables, and omega-3 fatty acids may support overall skin health. Stress management techniques, including yoga, meditation, and relaxation exercises, can also be beneficial, as stress is known to trigger or worsen autoimmune conditions. For those with oral lichen planus, maintaining oral health is crucial. Regular dental checkups, avoiding alcohol-based mouthwashes, and using gentle toothpaste can help prevent irritation. Some patients find that avoiding trigger foods, such as spicy or citrus-based items, reduce flare-ups. Lichen planus is a complex inflammatory condition that can affect the skin, mouth, scalp, nails, and genitals. While its exact cause is not fully understood, it is believed to be related to an abnormal immune response. The condition varies in severity, with some cases resolving on their own and others requiring long-term management. Early diagnosis and treatment can help control symptoms and improve quality of life. While there is no cure, medications such as corticosteroids, immunosuppressants, and antihistamines can provide relief. Supportive therapies, including phototherapy and lifestyle modifications, can also play a role in managing the condition. If you or someone you know has symptoms of lichen planus, seeking medical attention is essential. A healthcare provider can help determine the best treatment plan based on the severity and location of the condition. Thank you for watching. As always, take care of yourself and make the most of your day.